Hygiene. Today, here with me is Gretchen Van Wy, Assistant Commissioner of the Bureau of Vital Statistics, Svetlana Berdanik, an Assistant to the Secretary of the Board of Health, and Sherry Payne, Program Specialist in the Bureau of Vital Statistics. The purpose of today's hearing is to elicit comments and to assist the Board of Health in determining whether to adopt the amendments to Article 203 of the New York City Health Code regarding medication-induced termination of pregnancies. A notice of intention to amend Article 203 was published in the City Record on October 27, 2023. A copy of the first page of the notice of intention will be provided to the reporter to include in the record. Persons wishing to speak at this hearing were asked to pre-register. One individual pre-registered to speak today. Is that person here today to speak? I do. I see Maggie Carpenter is there. Maggie Carpenter has pre-registered to speak. I will now call upon her to testify. Ms. Carpenter, can you please start your testimony? And
Are you able to hear me?
Ms. Carpenter?
Yeah, it's Dr. Carpenter. Are you able to hear me?
Doctor, yes, we are able to hear you. So if you could please just state your name and your affiliation, spell your name for the record. You have 3 minutes and your time starts now.
Okay, my name is Dr. Maggie Carpenter. I am a family physician located in New Paltz, New York. And I also am the PC owner and medical director at Hey Jane. I also work with Aid Access and have my own practice called Nightingale Medical. It has been very difficult. I also am the medical director at the Abortion Coalition for Telemedicine. And so I'm representing all of these organizations and coming to talk to you. As you may or may not be aware, many states with the perilous times we're living in with regard to reproductive health have gotten rid of the onerous reporting requirements for abortion, less than 12 weeks. And for medication abortion in particular, now that we are doing telehealth and not seeing people in person, there really is no benefit to the state to be gathering this information, and it puts a undue burden on the providers and their administrations to actually collect that information. It also is something that is difficult for us to, it seems like a breach of people's privacy. Even though we're just doing initials, these can be identified, and we have lots of people coming to New York for medication abortion. The previous abortion requirements show that you had to, were stating that you had seen the products of conception, which obviously with medication abortion, you're not going to see. And since most states have now gotten rid of this in a time when we're trying to support abortion access, it seems like this is something that really needs to go away. And since there's no improvement in, this is not something that you're going to be able to get, federal funds for because of the Hyde Amendment. There's also other ways to be able to track the number of abortions being done in New York State other than the abortion reporting. There also seems that this is somewhat sexist because this is something that, it's not like men have to, when they get a medication for Viagra, need to go and get it reported to the state either. So I'm very opposed to having any ongoing reporting of abortions less than 12 weeks in New York State. And while I see that you guys are revising things, I do not see this easing our burden or improving patient security and safety in any way. I think that's probably it.
Okay. Ms. Carpenter, do you have a written copy that you want to, I'm sorry, Dr. Carpenter, do you have a written copy of comments that you would like to submit, or would you like to go with what you have just stated on the record?
With what I've stated on the record, as well as the written report that our lawyer, Adriana, already sent to the office earlier this week.
Did they submit it via written comments or?
Yes, and I signed it as well.
Do you know what email address? I mean, I'm not supposed to have a colloquy with you. Could you please make sure that it was sent to the address
All right.
that's in
It actually
the
looks
NOI?
like, yeah, it looks like it will be sent today. That was what I thought it had already been sent, but it is being sent today.
No, because we didn't have a record of receiving it. So, and comments closed today. So I just want to make sure that whatever you send does get in on time.
Yep. Yeah. We've actually, I'm interested in pursuing legislative action to get rid of the reporting as well, and have been talking to some of the senators and assembly people about that action.
Okay. Thank you for your testimony. And at this time, there doesn't appear to be anyone else seeking to testify. So we will adjourn.
Can I
until-
just make a comment, and you can certainly put this in the record, that I believe I have, from talking to many colleagues, that there are many other providers who would testify that they are not in favor of this reporting, but are not aware that this was even happening.
Duly noted.
And I know Adriana requested to testify, and she is.
We had received that you were the only person that was going to testify today. So if Adriana would like to testify at this time, Dr. Carpenter, we're going to turn your mic off and we're going to turn Adriana's on.
Excellent. Thank you.
Okay, Adriana, are you on?
Yes, hi. Thank you so much for the opportunity to speak. Can everyone hear me?
Yes, we can hear you. Could you please state your full name, spell your first and last name, and any affiliations? And I realize we went a little over with Dr. Carpenter, but please keep it to 3 minutes. Thank you.
Thank you. My name is Adriana Benedict, and I am General Counsel for Hey Jane, a telemedicine provider of abortion care based out of New York. We will be submitting a written comment, as Dr. Carpenter indicated, and I just wanted to highlight a couple of the points that are made in that comment here for my verbal testimony. The comment focuses on 5 points that underscore why Hey Jane is very concerned about the proposed rules expansion of ITOP reporting to encompass all prescriptions delivered in the city. We believe this is an unjustified expansion of government surveillance of women's reproductive health care decisions. And we believe the department, from the proposal we have not seen any justification offered by the department for such an invasion of privacy. Our concerns are as follows. This expanded form of reporting flouts HIPAA's right to privacy and protected health information. It exacerbates barriers to safe care. It sets a dangerous precedent for reproductive surveillance. It diverts strained resources from patient care, and there are less burdensome mechanisms for reporting aggregate prescriptions. And lastly, it is at odds with the important public policy of respecting a pregnant person's right to choose early termination of their pregnancy without government reporting of identifiable information. We take this position broadly with regard to any expansion of ITOP reporting that is not substantially justified with regard to the nature and quantity of data required. And I would just like to focus in particular for my verbal comment on our concern regarding HIPAA privacy. I apologize about that. To maintain compliance with HIPAA's minimum necessary principle, the department should provide a clear justification for why the collection of PHI is required in the new rule. But the department has not provided this justification. And in particular, the department requires the reporting of the first 2 letters of a patient's first name and the first 2 letters of a patient's last name, paired with additional PHI identifiers, including date of birth, zip code, MRN, and date of service. The department also requires highly personal demographic details, including marital status and education and ancestry origin. Because this information could be used alone or in combination with other information to identify an individual who is a subject of the information, its collection without justification is at odds with HIPAA. The department should provide a reason for the collection of each PHI identifier requested, consistent with HIPAA's minimum necessary principle. After Dobbs eviscerated the rights of privacy previously observed for pregnant people and their providers, HIPAA is more important than ever. In April of this year, the U.S. Department of Health and Human Services clarified the minimum necessary applies to public health reporting. They said, importantly, disclosures to public health authorities permitted by the privacy rule are limited to the minimum necessary to accomplish the public health purpose. In many cases, regulated entities need to disclose only de-identified data to meet the public health purpose. Indeed, HHS is seeking to close off expansive interpretations of HIPAA's exception for abortion reporting. They said, in light of that common understanding at the time of HIPAA's enactment, it is clear that the reporting of abortions does not fall within the scope of state activities Congress specifically designated as excepted from preemption by HIPAA. Even today, there is not a common understanding that the reporting of abortions to the city government is an exception to the right to privacy in PHI, much less a common understanding that local registrars of vital statistics have authority to mandate prescription reporting. Unlike deaths, births, and miscarriages, a prescription is not a vital event. Even if an abortion weren't a vital event, a prescription is not an abortion. It is a decision to obtain medication to terminate a pregnancy through 10 weeks gestation. And as with all medications, patients may change their minds. They may miscarry or decide to have a procedural abortion, or they may decide to carry their pregnancy to term. Perhaps a medical concern resolves or other circumstances change. Regardless of the reason, countless pregnant people who obtain abortion medication do not take it, and there is no vital statistics purpose of reporting their identifiable demographic information to the city government. Thank you for the opportunity to speak.
Thank you very much. We look forward to receiving your written comments. I am not seeing anyone else who is, I'm trying to see. I am not seeing anyone else who seems like they are here to testify. So, sorry, hold on one second. I'm having a, okay. Okay, at this time, we are going to stand adjourned until 2 p.m. Since there is nobody else here to testify, we will reconvene at 2 p.m. Thank you. That they would like to speak. Thank you. There being no persons present who wish to speak, this hearing is now concluded. Thank you.